Welcome to week 6 of Conversations on Healthcare. My name is Saki. I am a patient advocate. My practice is called Navon Health, and I'm based out of the greater Seattle area. And today I'm really honored to be joined by a colleague of mine who is also a patient advocate, serving in the greater Atlanta area. So Claire, can you introduce yourself?
Yes, I am Claire Thevenot, and I am the owner and advocate of Clarity Patient Advocates, as you said,
Awesome.
in Atlanta.
And we met basically through our, one of the professional organizations. And what has been nice for me personally connecting with you is that both of us are relatively new in the space, but have enough of a business background to kind of have understood the need for kind of additional pieces. And so we've spun off, you and I, and we have this networking group that we do weekly now, and a Slack group, and it's all been really exciting for me. I don't know about, your thoughts.
It's been great. But yeah, I've really enjoyed all the people that I've met, and it's been a really great, supportive, warm, and encouraging group of folks. So,
and I'm actually surprised more people don't do things like this, because I can't imagine, going it alone.
Right.
So, yeah. So one of the things that's fascinating is kind of the path that everybody takes to get to where we are, right? And so I was kind of looking through a little bit of of your background, and I saw that your business pieces really came first, right? You got an MBA, and then really decided to do nursing. What was it, maybe 15 years ago?
That's correct. So my children were coming out of elementary school, and I was kind of thinking about getting back into the work world. I hadn't really utilized that MBA too much. And my sister was a nurse, and I just saw that she had a lot of flexibility. She loved what she was doing. There were many different options. And I've always been interested in healthcare. And so I went back to nursing school, which that's a big decision when you're approaching 40 and you got little kids at home. And
absolutely.
Once I did it, I was so glad I did. And it's just spun off in a lot of different professional directions for me, but also it's put me in touch with some wonderful people. I love the patient care side. I started off in neurology for 3 years. I was on the floor in neurology, and then always had an interest in oncology for whatever reason, and then moved to the infusion center at our local cancer institute. And the thing that was particularly gratifying about that, as opposed to being on the floor, is we had patients that were coming in regularly. So you'd get to know them on a level that you couldn't when you just helped someone for 2 or 3 days after a.
And this was outpatient, yeah?
Outpatient.
Yeah.
And we had several physicians that sent their patients to us that were gynecological oncologists. So most of our patients were women. We had other practices that also sent patients to us, but a good bit of them were women. So I got to know them and their families and spouses, and it was just really a heartwarming experience.
That's great. I actually had a brief time going to an infusion center as well. I had I am a survivor of sepsis.
Oh boy, I didn't know that. Yeah, we would see people and give them daily antibiotics. Did you go every day?
So I was doing home infusions. They sent me home with a PICC line and boluses, and I had the whole thing. But I was visited on a biweekly basis, or twice a week, and then I think especially while they were trying to figure out the blood thinners, I had to go into the infusion center on a regular basis, and frankly, it was if any part of being so sick can be great, being in a place where everybody felt so connected to one another, and also to the clientele, that was really warming. And frankly, it's one of the things that I love about having been in healthcare for so long. Is that environment that, it's kind of how I've lived my life anyway, but it's nice to work in a warm, welcoming environment every day.
Yeah, it was. And I worked with a group of nurses that I had never worked with such a caring, supportive, fun. We would try to make it fun for the patients. On Halloween, we'd dress up in silly, costumes and have candy. And during sports seasons, we'd challenge patients to wear their favorite sports teams. We'd be talking trash about their team and things like that. Right. So we tried to make it as pleasant as possible given the circumstances. And that's kind of what I felt like the gift was, people would always ask me, how do you work with cancer patients? Isn't it hard? And there were hard moments, but basically I always thought it was kind of a gift to be able to maybe ease the way a little bit for people as they're, facing this challenge.
Well, I also think that people underestimate and undervalue the fact that it's a gift, as far as I'm concerned, to be able to have the confidence and the comfort to be able to deal with people who are suffering greatly, right? And to have empathy for that position, but be able to provide things that they need as well.
Right.
And that's really, what that's all about. So how did you wind up, talk a little bit about the path, right? So you focused a lot on cancer patients while nursing, but now yes. your patient advocacy practice is also really focused, on cancer patients as well and helping guide. How did that all come about? What was the transfer from nursing?
Well, I left the chair side. I was asked to head up a project, I guess you'd call it, of my hospital had purchased a group of cancer centers. So they were looking to integrate those 6 practices into the hospital system, get them up to speed with JCO standards, because they operated on different standards and so forth. And so
and what is JCO?
You're not even supposed to say JCO anymore. It's the Joint Commission. They go by the Joint Commission now, but the accreditation standards that the hospital has to follow. And so we wanted to make sure, or the hospital had to make sure that they all of the practices followed the same standards. And so I did that, and so I ended up moving into the quality world, and then from there worked leading up the hospital's tumor boards, which was a fascinating experience because you learn so much about all the processes, the thoughts, the everything that goes into a patient's care, all the different disciplines that are involved, and just hearing the cases was fascinating. But along the way, I was diagnosed with cancer myself. So I was diagnosed with advanced stage breast cancer in 2013, despite having mammograms, and that's a different story. It was missed on mammograms. So I became a cancer patient as well as somebody who worked in the world of cancer. And, it was obviously a shock and surprise and a devastating diagnosis. But, once I got over the initial terror, I worked in an environment where I knew which doctor I wanted to have guide my care. I knew what questions to ask. I knew what I needed to do for myself next, and kind of what was involved. And so there's a lot of comfort in that. And while I was, in my career working, other people knew that I'd had this experience and also this professional background, and they'd send somebody to me who had recently been diagnosed, and I went to some appointments with friends and friends of friends, and walked them through the process. So I'd been doing that on the side anyway, basically for the last 5 or 6 years.
The advocacy side.
So this was just advocacy, just doing it for family and not really family. I haven't had a, and so it's just kind of naturally, was an extension of what I was already doing.
That's great. That's great. And I think that becomes like a really natural transition, right? Because so many of us, I think my sepsis experience is what kind of, directed me to realize the importance of this. But so what has it been like in the Atlanta area, or just your experience in general in terms of now that you're out and about? I know one of the things that we often talk a lot about on our professional forums and in our networking groups is this idea that people don't really know what it is that we do, right? Or even that advocacy is a profession.
Yes, there's a lot of education that has to go on there. And I think people don't realize they need an advocate until they're kind of in the thick of something, because they can't figure out, or they have a physician that can't figure out a diagnosis, or they can't coordinate care between multiple clinicians. I mean, there's just so many times when patients find themselves in difficult situations and they need somebody to help them, even if it's, billing and figuring out their insurance, things like that. So, yeah, it's definitely educating people. I've even had other nurses ask me, well, don't insurance companies do that, or don't hospitals do that? Well, hospitals and cancer centers anyway have patient navigators, which do a lot of what we do, but not to the same extent. I mean, they touch base every now and then. They, check how you're doing. If you need a little extra hand holding, they might spend a little more time on the phone with you, but they're not going to go to different appointments and write up reports. And they work for the hospital. So their ultimate interest is to the hospital. And same thing with insurance companies.
Right.
So
and I think that's a big key. As independent practitioners, we're really accountable to our clients and the patients.
Exactly.
Yeah.
So yeah, when I explain it to people, sometimes the light bulb will go off. For example, when I was first starting my business, I met with a business, a volunteer at business consultant at SCORE, and he was totally interested in the idea and super excited about it. He had a child that had chronic illness, and he said so many times when my son was younger, we needed somebody to, could have really used somebody to go to appointments with him, because he was kind of on a path where things were stable, and so he didn't have to have parents, go to all the appointments, and they were working and so forth. So it would have been nice to have somebody that could have been there for them to help out.
Right, and I think that's something that we hear all the time, is this idea of somebody having gone through an experience and in hindsight saying, gosh, I really wish I'd had somebody. So I think the question becomes for us, so what are the things that you're finding people would be searching for? So, let's say you have the experience of, this guy who was interested in advocacy, saw the benefit in it. Now he hasn't met you, he's never heard of it, but he still has this issue with a family member, himself. He sits down in front of the computer. What does he look for?
Yeah, and that, unless patient advocate, you don't know to really search for that. So That's kind of the key thing is, again, it's educating the general public about this relatively new profession. And what's kind of interesting is when I tell people, I've had a couple of people say, well, that's a really good idea. Well, it wasn't just my idea. I didn't just come up with it. I said, well, we have professional organizations. There's certification. It's a real thing. And so there, again, I think it's going to be one of those things that we're really on the leading edge of getting the patient advocate more well-known and visible for people who might need our services. Right. And so, in 5 years, probably you won't have to explain it to everybody. Right.
It'll be much more aware. So how has your experience, I mean, I imagine as a nurse, you have worked on both sides and kind of understand a little bit of the difference. As I don't have any clinical background, even a long time ago, I was a medic in the military. That's my clinical background. Um, but um, but I have had a lot of experience in healthcare, running medical practices, and just frankly, life. Having my family, probably more than most, has spent an inordinate amount of time in hospitals with family members or with friends who've had accidents, and we're often somebody that people have been called on. So I'm very comfortable in these stressful environments. I'm also very aware that in medicine, there's very much this hierarchical kind of setting in which, certain people, we like to joke a lot of times. My wife, who's a physician, always says, somebody had wanted to get her a button that says, I'm the doctor and you're not. Right. And so
Yeah.
what's your experience been having to, have you come ahead, upon any obstacles or people kind of pushing back at this need, a threat in some way?
No, not so far. I haven't had a problem. You mean interacting on behalf of clients with a physician?
Yeah. Yeah.
No, I haven't had an issue. I think there is some education, that's happening because most of the physicians I've spoken with, again, have never heard of a patient advocate. I think the term advocate sometimes might make one think that it's an adversary, like you have to have an advocate because something's not going well. And I never would want a physician to think that I've been called in to keep them in line or something like that. It's really, we're partnering with the client and their healthcare team to make sure that all their needs are being met. So actually, we're kind of in a way an extension of the physician, that we can make sure that the client understands their treatment plan, that they stay compliant, that they get their questions asked. So if you look at it that way, we're really helping out the physician. I went to my regular women's visit with my GYN a couple weeks ago that had been rescheduled, and I told her what I was doing. And GYNs, they're the ones that end up letting patients know if they have breast cancer, the breast cancer results from their studies and biopsies, and also GYN cancers. And so I gave her several of my brochures and cards, and I said, if you have patients that find out they have cancer and they need some extra support, please think of me. And she was so enthused. She said, this is great. I know so many people that could use services like this. So again, I think if physicians do what we did and had a better understanding, those that may be inclined to push back wouldn't.
Yeah, and it's interesting. I like the way you laid it out. I think I kind of share the same thing in a slightly different way, in the sense that I like to tell all providers that I'm interacting with on behalf of my clients, that the reality is I'm actually advocating for both sides. I'm not advocating for one or the other. And all medical practitioners, most, want their patients to get better. Right. And so compliance is important and understanding is important. But the reality in today's medical environment is that, clinicians don't have the time to explain things to a lot of people, or they do explain it and the patients don't really understand, but they don't want to ask. So,
or they don't know what they don't understand, so they don't know how to ask something. It just is a lot of jargon, and they're trying to piece it all together to figure out what's the big picture, what are they saying.
Right. And interestingly, that for me is, I think one of the more exciting pieces is being able to translate, and pick out things that the clients may not have heard. I had a recent experience where I'm with COVID, everything I'm doing at the moment is virtual, right?
Right.
And so, but it doesn't mean we can't attend an appointment together. And a lot of patients are doing virtual appointments with their practitioners anyway. And so I'm on the phone just kind of listening to the visit and making notes, and I'll write up a summary and send it to them afterwards. And the spouse of one of my clients, came back with like, wow, I never heard him say this. And I didn't realize that they were saying this. And I didn't know that that's what this meant.
Exactly.
And so that feels really great.
Yeah, and I have a client whose daughter lives out of state. And so she sends the notes to her daughter so she'll know what happened during the doctor's appointment. And that piece never even occurred to me. It's not just for the patient, but it's to help their families know what's going on and what was said and what the plan is.
Well, it's interesting too. I don't know what you think about this, because there's always this idea and concern for confidentiality, obviously, but so one of the positives in my mind that has come from COVID-19 is the incredible explosive growth of the use of video technology for communication in general, but specifically in medicine. I can't remember which conversation it was, but recently somebody was talking about there's a lot of advocates who do end-of-life stuff. And the important thing in that field is very often helping families facilitate conversations. Right. So have you had any experiences yet where you're sharing this kind of information with other family members who maybe you haven't even met?
No, actually, I haven't had that opportunity. That
I think
it's they could be difficult experiences. No, I've mostly worked with my clients and their family members were present, so I interacted with everybody at one time. Or, as I said earlier, my reports, the notes that I write up, end up, the client will send them to whoever they want to share it with.
Right. And that's actually great. Again, it's another gift I think that
right.
people can give to their family members to give them some comfort, that things are being taken care of.
Right.
So, so what do you think is needed for us as advocates to help elevate, the profile of the profession? What would you see, like in your ideal world,
I think, for example, I network with a couple other advocates in the Atlanta area, and we've are planning to get together and kind of talk about that. I think going out into the community and doing volunteer work, presenting it in different, community events or organizations like, the Y. I know our local Y that I used to go to, haven't gone to lately, would have community talks and things like that related to things that were important to their clientele. And so I just think we as a group of professionals need to work together to raise awareness. And as that happens, patients will be able to find us and get their needs met better.
Right. I know that I think I'd mentioned on one of our networking calls the other day, I'm part of a really great organization in Washington State called the Washington State Association, the Washington State Health Advocacy Association. And the more organizations like that can grow and become prevalent, the easier it's going to be for people to find us.
Right. No, I agree. I know Washa has been pretty active, and they're kind of almost a role model for groups in other parts of the country to do the same.
Absolutely. And interestingly, it turns out that Washa has plans to actually go national. And it makes sense. Obviously, I think that they will rebrand and change the name. But I was on, so they do, Washa's been around about 12 years, I think. And it was one of the first organizations I joined because that made sense, doing health advocacy in Washington State. So they do these quarterly networking meetings, which I've done, I don't know, 3 or 4 of them now. We just had one that's done via Zoom. There's 2 people from the East Coast. There's, somebody from Louisiana. So somebody from Texas. So people are already reaching out because Washa's made enough of a presence that they are a good resource, frankly, for anybody. And I think it'll only be, advocacy organizations, I think, for local areas tend to be most beneficial when you're kind of advocating for, maybe policy in a local area.
Right.
But when it's just to, elevate a presence and educate, as you had said earlier, it can be done anywhere, right? It doesn't have to be local. So, yeah.
When we are out of the COVID hibernation, I would love an opportunity to speak with local physician groups just to let them know, what we do and how we can be beneficial to their patients. And I think as a group of advocates trying to reach the physicians just to let them know, what we're doing will be important too.
Well, and I would actually challenge you to say, you don't need to wait because the physicians groups are still meeting.
Good point.
And they're meeting like we're meeting now. And in all honesty, I'm finding that there's potential for even greater reach than you would be able to get by physically going somewhere. You could still get the same interactive back and forth. It's not the same as being face-to-face.
Right.
I'm not even comparing it, but we live in a new time and new normals. And, COVID doesn't seem to be going away anytime soon.
No, it doesn't.
And so, don't wait. Let's get out there. And I'm excited to learn from you to see what you find, is effective in your area in terms of connecting with people. And obviously, from my perspective, all I want to do is if I find any wins that I find are working for me, I just want to share those.
Right. Yeah, we've been lucky that we found a group of people that enjoy connecting so well and are free with sharing information. It's been wonderful.
Yeah. So any parting thoughts, anything that, you would want people to know about the work you do that, you don't have an opportunity to say? So let's pretend right now, this is your promo video.
Oh.
Okay. What do you do? No pressure. Come on. I mean, and not everybody's so comfortable in front of a camera, and I get that. But it's just you and me, right? What is it that you want people to know about what you do that,
I want them to know that a patient advocate, or I, am available to help them understand the healthcare system, because I know it's very fragmented, very confusing. So a health advocate or a patient advocate can guide you through all the different areas of healthcare so that you get the best care. You know which physician you're going to, not just the one they referred to you. You have somebody at your side who can take notes and make sure that everything gets put down on paper so they can refer back to it. If you have problems with billing or insurance, patient advocates, we're as a group very well-rounded, and any need that a patient has, and every patient can benefit in some way from advocacy. Even before I started this, I knew that if ever I had a family member in the hospital, I would never let them be there alone. And that's not because there's not great hospitals and great nurses, but the healthcare system is complex, and nurses are they're understaffed and have too many patients. And so I just think that everybody, even in the best of circumstances, should have somebody at their side when they're, dealing with the healthcare system.
Yeah, absolutely. And I couldn't agree more.
So that's the nugget. Is everybody needs an advocate.
Yeah,
That's
no,
my
absolutely. It's perfect. It's perfect. So thank you again for making the time to do this. I feel
Sure.
really blessed that that we connected, because I feel like we are all always stronger together.
Yes,
And it's
absolutely.
always great to have, strong advocates for advocacy,
Right, exactly.
in different places. So Claire, thank you so much again for making the time.
You're very welcome.
And
Thank you for asking me.
yeah, yeah. So hang on one second.